So does a hair transplant hurt? Seems like a pretty logical question to ask. The truth is that with modern techniques, what we do now, especially with FUE surgery, which is what we specialize in, this is very minimally invasive surgery. And when you hear that word, minimally invasive, it really does, it should make you think about how, oh, this is going to be less painful than I think. And nothing is more minimally invasive than what we're doing. So it's very different than the old times of such surgery that we used to do with, cutting the scalp and moving it around. These are not the same incisions anymore. They're very tiny, and that means it doesn't register that much on a person's pain scale. And even, when you know the anatomy of the scalp like we do, you can get numbing injections done pretty quickly and easily on a patient with barely than batting an eyelash. And that's all we're doing with this. We are doing numbing injections just like you would get at a dentist. And everybody's been through the numbing shots to get a dental cleaning or a wisdom tooth removed. Those are not fun. It is much easier to do that in the scalp. So we can get our patients numb and comfortable and keep them that way the entire process of their surgery. And even in the recovery process for those few days after surgery, my patients are not having to use much more than Tylenol, if that, to manage a little bit of discomfort. So this is very different than people imagined what was done in the past, and way easier than you can think of.